Hello everyone, this is Alka, a founder of Mission Care Organization. And as we mentioned, we are having a program called Info Eve. In this program, we will be talking about the current topic, COVID-19 and flu. Everyone knows that flu is going to be very different this year. So we have invited Pallavi Gajaralwar. She is a pharmacist in one of Lablo Pharmacy, and we will be asking her few questions regarding flu and COVID-19. I would like to invite Pallavi on my screen. Hi,
Hi. Hi, Alpa. How are you doing?
I'm good. Welcome to our
Welcome
program.
to our program.
Thank you so much, Alpa. Thank you for inviting me. And it's um, it's a really good initiation from you to do something about current situation, flu and COVID.
So,
So, uh,
as we all know that this year flu will be very different than all these years, right?
all this years,
So
right?
how, what do you think,
So, what do you think?
how it will be different
How
this year
it will be different this year
regarding to
regarding
COVID-19?
to COVID-19?
So recently, our Honorable Health Minister, Ontario Health Minister Christine Elliott, said that this year flu season is going to be very bad. And I think all healthcare professionals across the board are thinking the same way because it's not just one thing we are going to deal with, which is COVID-19 pandemic. And as you know, the cases are rising already. It's also on top of it flu season. So it's going to be really overwhelming for healthcare professionals as well as on our healthcare system. It's going to be pretty strained that they are going to deal with COVID as well as flu. So let's see what happens. Hopefully, everything goes fine. But as I mentioned, throughout healthcare professionals, they all are saying that this season is going to be tough on us.
Yeah, absolutely. That's what we all here for.
Yeah, absolutely.
I
That's
just
what
have
we
few
all here
questions
for. I just have
regarding
few questions
flu and
regarding
COVID and
flu and
again, like
COVID and
just like common cold and
again, like
fever and
just
all
like
that,
common cold.
because thing has
Yep.
almost same symptoms, as you know, right? So,
Has
how do you
how do
differentiate
you differentiate
COVID-19 symptoms,
COVID-19
flu
symptoms,
symptoms, and
flu symptoms, and
common cold
common
or
cold
viral fever
or viral fevers
symptoms?
symptoms?
That's a good question. Yes, you are right. There are so many symptoms which are common in three of them, but there are differentiating symptoms too. So let's start with COVID. Usually, COVID symptoms are mild to severe, and the onset is around 5 to 6 days, up to 14 days, which can be the onset period after exposure to COVID. Now, in COVID, fever is common. Fatigue is sometimes. Cough is usually dry, hacking cough. Sneezing, there isn't any sneezing in COVID. Aches and pains, there are sometimes aches, body aches and pains. And there's also headaches sometimes. But the most important thing is difficulty in breathing. Difficulty in breathing and loss of taste and smell are common things in COVID. Diarrhea with COVID is rare. But if you go to cold, cold onset is very gradual. It's not sudden. Um, in that fever is rare. You don't really get any fever as much. Fatigue, yes, there is sometimes. There is also cough, mild cough, but it's not one of the main symptoms of the cold. Sneezing, yes, it's very common in common cold I'm talking about. Aches and pains are common. Runny, stuffy nose is common. Sore throat is common. Diarrhea, no, there isn't any diarrhea in common cold. Headaches is rare. Difficulty or shortness of breathing is rare. And loss of taste is rare. But when we compare with flu, the onset is really sudden. Within 2 or 3 days, there is onset of flu symptoms, in which there is high fever, which is very common. Fatigue, yes. Aches, pains, body ache is common. Cough is usually dry, which is also common. Runny nose, stuffy nose is not sometimes, not really all the time there. There isn't any sneezing in flu. Sore throat sometimes, diarrhea sometimes, particularly in children. Headaches, yes, it's common with flu. Shortness of breath or difficulty is rare. It can happen only when you get flu complications, the shortness of breath and difficulty. Loss of taste, there isn't any loss of taste in flu. So these are the differentiating things with cold, common cold, COVID, and flu.
And
And
uh,
uh,
like, what do you think?
like,
Who
what do you
are at
think?
the high
Who
risk
are at the high risk
for both
for
COVID and
both
flu?
COVID
And
and
are
flu?
they like
Are they
same
like
class or
same class
different
or
classes?
different classes?
Yes, there are a lot of commonalities when you compare the risk factors for COVID and flu. Let's start with COVID first. COVID, as we know, we have been saying senior people, 65 and above, are at high risk of getting COVID. Anyone who has immunocompromised diseases like cancer, also medical conditions like lung disease, heart disease, diabetes, high blood pressure, liver disease, kidney disease, dementia, stroke, they are all at risk for getting COVID. And recently, we are also seeing a lot of COVID cases with people with age group of 40. So I would say, yes, most of these people are at high risk of COVID. But when it comes to flu, the commonalities would be again same, 65 years and older. Population are more at risk of getting flu. Uh, Cancer patients, diabetes, heart disease, lung disease, anemia, obesity, kidney disease, um, any person with neurological condition or neurodevelopmental condition, these are at high risk. Kids are at high risk. Pregnant women are at high risk. And I will also add to it anyone who is giving care, like childcare workers, like healthcare workers. These are the people who can transmit flu really easily, and they are also would go in high risk, and they should also be getting a flu vaccine.
Right. And is there for all these high risk people, is there any precautions they can take just to avoid it or just to be
High risk people. Is there any
for COVID
precautions
and as well as flu?
for COVID and as well as flu?
So for COVID, it's really open book right now. Wash your hands thoroughly, put on your mask, social distancing, avoid going to crowded places if you can. So these are the common things we need to do. Unfortunately, we don't have any COVID vaccine yet. We should be getting there soon, hopefully. But we need to practice as much as whatever government guidelines have been given. That's what we need to practice to keep ourselves safe from COVID. Now, with flu, the most important thing I cannot stress enough how important this year is to get a flu shot. That's one thing which is going to prevent us from catching flu and saving our loved ones. Apart from that, again, it would be same, washing your hands thoroughly for 20 minutes with soap water. If you do not have any soap water, alcohol-based sanitizers are good to use. Whenever you are coughing or sneezing, use a tissue paper, cover your mouth. If you are not feeling well, if you have flu symptoms, don't go out, don't go to work. That could help preventing from spreading this flu. And these are the common precautions we should be taking while we are, if somebody has flu.
Interesting.
Interesting.
Uh,
Uh,
so
So
we know every
we
year
know every
uh,
year uh,
we talk about the flu
we talk
shot,
about the
like
flu
years,
shot
not every
like from
year,
years, not every year,
and
and
everyone thinks that
everyone
like why
thinks
to
that
take flu
like
shot,
why to take flu
you know?
shot, you know?
So what do you think this
So what do
year?
you think this
How
year?
important it is?
How important it is?
I think this is the most important year you should be taking flu shot. We don't have any COVID shot yet, but we have a flu shot. We can prevent ourselves from flu, prevent our loved ones from flu, getting flu. Any person who have underlying medical conditions, we can prevent them from getting flu. So we should be taking. And I would also like to add that if we get a flu shot, in Canada alone, yearly there are around 3,500 deaths due to flu
Oh wow.
and around 12,200 hospitalization due to flu complication. Now, this all can be actually prevented by taking a flu shot. So why not? Now, my second thing is if you're not going to get a flu shot, and if you're going to go for any emergency or any medical condition or for flu symptoms that matter to hospital, our hospitals are already overwhelmed with so many COVID cases, and you are going to a place which is you really don't know, you can catch COVID or flu from that place, right? So I think I cannot stress enough how important it is to get a flu shot this year.
So do you think like we should take flu shot every year, not just this year,
Yeah, every year,
So
every
do
year.
you think?
because flu will be there forever?
Yes, flu will be there.
Because flu will be there forever.
But
So every year we need to take a flu shot. But there is also another theory to it that the flu virus strains keep on changing. So what they do is they look into our health ministry or health department looks into where in Australia how is the flu season, and they map according to the Australia, whatever happening in Australia regarding flu, they map in Ontario and they see, okay, these are the strains which are commonly found. So what they do is they make a flu vaccine accordingly, and that's why the flu vaccine needs to be taken every year because the strains keep on changing, and even after taking flu shot, after an year, our immunity towards flu goes down. So we need to take it every year.
uh, we have heard like so many people thinks when you get flu shot, you get
Uh,
flu.
we have heard like so many
What do you
people
think?
thinks
What
when
are
you get
the
flu
like
shot, you
myths
get flu.
versus facts about
What do
flu?
you think? What are the like myths versus facts about flu shot?
Uh, Flu shot you cannot give you flu. That's a myth. When you're taking a flu shot, like with flu shot needle, the virus is already inactivated. So there is no way that can give you a flu. Yes, there are aches and pains and a little bit of body ache, but flu shot will not be the precursor of getting you flu. Now, the second thing is there is vaccine which is no spray, which is live attenuated vaccine, which means it's also a weakened virus which is in the nasal spray. So even that should not be giving you a flu. So side effects, yes, there are side effects, little bit of pain, feverishness, but that goes away in 1 or 2 days. I remember, Alpa, when we started doing flu shot in pharmacy in 2015, you were hesitant to
Of
take a flu
course,
shot.
I never took it before that.
And yes, you had
Of
never
course,
taken.
I never took it before that.
Maybe you can tell your viewers that you have been taking flu shot for last
Almost 5 years. So, and
5 years
from
now.
then,
Almost
I
5 years.
am the first one to take flu shot in
And
our
from
farm.
then, I am the first
From
one
then,
to take flu shot in
uh,
Yes,
our pharmacy, right? And from
I
then, thank
get
God,
flu
I did not
for
get
last
flu
5 years,
for last 5 years.
and that's the truth.
yes.
And that's the truth.
Because
Because
before
And
that, every year
before that, every
I
year
was
I was
like getting
like
flu
getting
for at
flu
least 10 days
for at
or
least
so.
10 days or so.
Especially January,
Especially January
I'm
first
always
week.
on leave,
I'm
yeah,
sick
always
leave
on
because of
leave,
the
sick leave
flu.
because I
But seriously, from last five
seriously,
years,
last five
I
years,
did not get,
I did not get flu.
and I am the first
and
And
one.
you
I am
took a
the
Let
flu
me
first
tell
one.
shot.
everyone,
Let me
I'm the
tell you,
first one to
everyone,
take
I'm the
flu
first
shot
one
in
to
my
take flu
pharmacy.
shot in my
Yes,
pharmacy.
yes.
So it
And you
does
took
work.
the
So
flu
it
shot.
does work, yeah.
Yeah, and it
Yeah,
worked,
yeah,
right?
absolutely.
Yeah,
Yeah,
so
absolutely,
right
absolutely.
there. Yeah. So, and what is the trend that I'm seeing is more and more people are getting aware of flu shot, and they do come to pharmacy to take a flu shot. Like I'm just telling, my numbers in pharmacy are increasing. People are willing to take. So there is definitely a truth behind it that flu shot does work.
Yeah, and we know that obviously doctors
We know that
they have
obviously
flu shot
doctors
every year,
they have
but
flu shot every
you
year,
have to take
but
appointments and
you have
all
to take
that.
appointments
So,
and all that.
what do
So,
you think? Like, what's the
what do you
best
think?
place
Like, what's the best
to
place
get flu shot?
to get flu shot?
I mean, I would definitely say it's up to an individual wherever they are comfortable taking flu shot. But what I feel is, as pharmacists, we are most accessible to the community. We are the first healthcare provider which really don't need any appointments. You can just walk in and take. It's really well and good, but really you don't need to take an appointment. So pharmacists and pharmacies are very accessible to most of the uh, communities. So I think pharmacists and are doing wonderful job. I mean, I take a pride in saying this, being a pharmacist myself, in giving flu shots, and um, that would be a best place. But again, it's up to the comfort level. Wherever you want to go, do go, but take a flu shot.
But I think this
But
year,
I think this year
pharmacy,
the
that will
pharmacy
be the best place
that would be
to
the
get
best
flu
place
shot
to
because
get
you
flu
know our
shot
doctors
because
are there,
all doctors
not
are there.
taking
They're not taking
patients. Uh,
inpatients.
you have to book
You
like
have to
online
book like
appointments
online
and all that.
appointments and
So
all that.
I
So
think for this
I
year,
think for
pharmacy
this
will
year,
be a good place.
pharmacy will
I know
be a
you're
good place, and I
Yes,
the
know
best
you're
flu
absolutely.
shot
the
giver.
best flu shot giver.
Absolutely. Thank you
I
so much for that
I would
compliment.
understand everyone but me.
But yes, absolutely. Pharmacists would be the best people to provide flu shot this year. And as you mentioned, not a lot of doctors might want to have so many people coming in because if you see it's a closed area, and think about so many people coming in flu shot, you don't want to get doctors' cabin overcrowded. But
Of course, yeah.
yes, absolutely. Pharmacists are promoting flu shot, and I would say they are doing really good in giving flu shots. So yes, you go ahead and take your flu shot in pharmacies.
Yeah, this year I'll be there too. Just one more question.
Yeah,
There's
this year
this
I'll be there too.
high dose
Just one more
flu
question.
shot
There's
every
this
year.
high dose flu shot
So
every year. So
what is
what
that
is
for, and
what is
who's
that
that
for,
for?
and who's that for?
Very good question. This year, I mean, it's been there for almost 2 years, if I remember correctly, but high dose flu shot is for 65 years and above, our senior citizens. And when it started, uh, I think 2 or 3 years back, the doctors used to give it. But now government wants us to give high dose flu shot to senior citizens, and that is absolutely because of the accessibility of the pharmacies. So high dose flu shot is for only 65 years and above. It has 4 times more of antigens, and because 65 years and above, our seniors immune system is not as good as other people. Right now the recommendation is to give only to 65 years and above, and we'll be giving
And
we'll be government is going to send us too, so pharmacists are going to give high dose flu shot to all
That's
senior
great.
citizens,
that's great.
I
That's great.
remember
whoever
I
wants it,
it
of
remember
course.
wasn't covered
it
by
was
government.
covered by
Seniors had
government.
to
Seniors had to,
pay.
I think, pay.
What about this year?
What about this year?
No, they are not, it's free, they are not paying for it.
Okay, great. That's
Okay,
great.
great.
So,
That's great.
Yeah.
So,
what do you think? Like,
what do you think?
till
Like,
what time
till
you'll be getting
what
flu
time
shot?
you'll be getting
And
flu shot, and
obviously, you'll be giving
obviously you'll be
all
giving
those
all those
high risk patient
high risk
first,
patient
right?
first, right?
So, as per the recent communication from Ontario Health Ministry, we are going to get flu shot around 5th of October. So, it's going to start around 5th of October, and it's going to be there for only for high risk patient. That would be our senior citizens and anyone with underlying medical conditions. So, we'll be starting for them earlier. 19th of October onwards, it will be for everyone. So anyone can come and take flu shot from 19th of October. Whoever who doesn't have any medical conditions or who are youngsters, or their health is fine, they can come later. But first, from 5th to 19th, we'll be giving senior citizens, and anyone who has chronic health conditions.
One more thing. What about
One more thing. What about
students?
students?
Are you giving flu
Are
shot
you giving
to
flu
them
shot
who
to
has
them
not
who
or
has not OHIP?
they have to pay, or
They have to
how does
pay,
it?
or how does it work?
So, to students who do not have health card, we'll be still giving it, because you know what government wants is a herd immunity, and there isn't any cost to them. So we don't want to leave them on their own, not giving them a flu shot. And last year, I saw more students, international students, coming in pharmacy and getting a flu shot because they wanted to be protected against flu. Just imagine an international student not getting a flu shot, and if he gets in a flu complication, you know, and ends up in hospital, it's more cost to them. So we are giving to everyone.
Including visitors,
Including
or
visitors, or
Visitors, that's a good question. I I'm not really sure about that. I can get back to you with that, but I'm not really sure about that.
sure.
sure.
But it's nice
Yeah.
to
But
hear
it's
that
nice to hear that
free
flu shot
and
is free
everyone
and
should get it.
everyone should get it, especially this year. Yeah.
Yes, it. I would say we have to have and stop prevention or complications of flu and ending up into hospital. So why not get a flu shot?
So
So
if
can
let's
we
say
if
you're
let's
taking
say
you're getting
you're
the
getting
high dose vaccine
the high
first
dose
for
vaccine
seniors.
first for all seniors.
So
So
whoever who has
whoever who has
parents in their house 60
parents in their house
above
65 and
and
above,
they don't want to go to
and they don't want to
doctor
go to doctor's office,
and they want
and
to
they want
be
to
protected.
be protected.
So
So
can they
can
book
they
an appointment or
book an
something,
appointment or something,
and
Oh yeah,
you
absolutely.
can
you can
Yeah, yeah, absolutely. So you can book your appointments, you can call the pharmacies, and most of the pharmacies would be giving high dose flu shot for senior. And let's not forget just seniors. We are also giving to people early on from 5th October who have underlying medical conditions like cancer, diabetes, high blood pressure, or pregnant women. So we will be giving all these high risk patients flu shots. So yes, you can book your appointment. I know some of the pharmacies would be conducting clinics, especially for seniors. They would be opening earlier on to give a flu shot to the. I mean, it will depend on pharmacy to pharmacy, but you can definitely call. So that way, they will. There's no rush. Seniors can feel safer. They come in, take a flu shot, and go. So a lot of things are happening. It's very exciting to see. In like what all is there on plate, and all you need to do is call pharmacies and talk to them what are their programs of flu shots and get your flu shot there.
let me just tell
let
everyone,
me just tell
because I remember
everyone,
in pharmacy when
because I remember
we
in
were used to
pharmacy
ask
when
people that we want to
we
flu
were
shot,
used to
and
ask
they'll
people that
always
do you
say
want to get flu shot, and they'll always say I'll get it from my
it's
doctor.
just that
It's
their
just
belief that
that
only doctors
their
can give
belief
flu shot.
that only
But let me
doctors can
tell
give
you
flu shot.
that
But
pharmacists
let me tell you
they
that
are trained,
pharmacists are
they have
they are
certificate,
trained,
and
they have
they are
certificate,
absolutely
and they are absolutely
better than doctors.
better than doctors.
You don't have
Oh,
to
thank you so
You
much.
don't have to
you
wait.
don't have to wait.
You don't have to
Especially
wait,
Pallavi,
and
let me tell you,
especially
she's very
Pallavi, let me tell
gentle.
you, she's very gentle.
Oh, thank you so much. Yeah, I mean, people do earlier on thought in only doctors could give, but now people started, they are aware that pharmacists are doing equally fantastic job, and we have been getting phone calls and inquiries since almost starting of September, that when are your flu shots coming in? And let me also tell everyone that these flu shots are same what doctors get and what we get, because it's been given by government. So Ontario Health Ministry is giving us all these flu shots. So it's not that we are giving different flu shots than
Yeah.
doctors or theirs is
Yeah,
effective.
yeah.
So it's the same
Yeah.
across
That
the board.
Yeah,
Yeah.
that was also
few
concern
people
of
that
a few people
same
that is it
or
the same,
we have
or
like cheap
we have like
or
cheap
like
ones, or
free and
we are
No,
giving free and all that, you know.
no.
one
So
last
it's covered by government.
yeah, one
There's
last
one
question.
question.
So
Yes.
Yeah, one
I
last
know there is
question.
no vaccine
So
or there is
I know
no
there is no
treatment
vaccine or
for
there is
COVID
no treatment
yet,
for COVID-19
uh,
yet.
and the
Uh,
symptoms
and
are
the
almost
symptoms are
similar
almost
unless
similar
you get test
unless
done.
you
You
get
don't know if
test
you
done.
have a
You
flu
don't know if you
or
have a
you
flu
have
or
COVID.
you have COVID.
So in that case,
So
uh,
in that case,
let's
uh,
say in
let's
first week,
say in
what
first week,
treatment do you
what
recommend?
treatment do
Like
you recommend? Like, do
just go for the
do you
test,
just go
or
for the
you can
test, or you can
start
just
some treatment
start some
as
treatment
symptoms are
as symptoms are almost same?
So I would say here, if you go to Ontario government website, they have online questionnaire, which would tell you exactly whether the symptoms are COVID related or COVID or not. So everyone should get that online test done. They just there you have to drop in and you have to just select the menu. Oh, I have this, I have difficulty in breathing, I have fever and all that, and it tells you right there whether it's COVID or not. As I said earlier, anything like difficulty in breathing, high fever, and loss of taste, smell, these would be COVID symptoms. Symptoms are mostly high fever, body aches, dry cough. COVID also has dry cough, but there isn't any loss of ta taste or smell. So I would recommend that you go online, check whether your symptoms are there, and it will tell you right away, yes, you have COVID symptoms or you don't have. And accordingly, then you can get tested if you think you are COVID symptoms. Um, Flu symptoms, as I said, are different. So it's 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 really a very thin line right now. But if you're not feeling well, if you have fever, cough, don't go to pharmacy, don't go anywhere. Talk to your healthcare professional whether it's right time to take a flu shot or whether you should be getting yourself tested for COVID.
so I
So
remember if
I
you are sick,
remember
then
if you are
you
sick,
should
then you
start
shouldn't take flu shot
long.
for how long?
Oh, until you get better. So if you have any fever, earlier it was, oh, if you have cold, cough, fever, uh, especially fever, don't get. But right now, we don't want to mix anything. And because the symptoms of COVID and flu are so near. So if you have any cough, cold, fever, do not take a flu shot, or do not go to the pharmacy, or do not go to doctor's office. Call your healthcare providers like pharmacists or doctors, and they will let you know if it is safe or not.
Can you
Can
take
you
like something
take like
until you go to
something
doctor
until
or
you go to doctor or
know what
until you
exactly
know what
can you
exactly
take
you have?
anything
Can you take
maybe
anything like
symptom
maybe for symptoms,
fever
maybe
Oh,
let's
yeah.
say fever or cough or something?
Yeah. So if it's flu and if you have fever, if you have cough, you can definitely take over-the-counter acetaminophen. Lot of rest, drink plenty of water, and these are the things. Usually, flu would go away within 7 days, but if you see on top of it, you have difficulty in breathing and you have difficulty in smelling and have difficulty in tasting any food, then you should definitely go for COVID test.
perfect. What's your last
Perfect.
message?
What's your last message to everyone?
My last message to everyone this year would be get your flu shots. Get your flu shots. Make sure that your loved ones get your flu shots, like your kids, your senior citizens. Everyone should get a flu shot. It's important. It's important not to end up in flu complication at hospital and not to catch up something from there. It's important that we all do our part. Government is doing their part by providing flu shots. So get your flu shots. And if you think you are sick, if you think you have any of the cough, cold, fever, Do not go anywhere. Talk to your healthcare provider, and they will tell you what will be the best thing to do.
That's awesome. Thank you so much.
That's awesome. Thank you
I
so
think
much.
you have given all
I think you have
needed
given
information,
all needed information,
and I will
and I
request
will
everyone
request
to go
everyone
to your
to go
nearest
to
pharmacy
your
or
nearest
doctors,
pharmacy
and
or
do not
doctors,
forget
and
to
do
take
not
your flu
forget
shot
to
this
take your
year.
flu shot
Any
this year.
question you
Any
can
question you can
us.
contact
You
us.
can contact our
You can
team. You can
contact our
message us.
team. You can message us.
And if
And
anyone wants
if
to take flu
anyone
shot,
wants to take
your
flu shot,
parents
your
maybe,
parents maybe,
if
and
you
if
want
you
us
want
uh,
us to
organize a clinic, we will
organize a
do that for
clinic, we will
sure.
do that
I
for
will post
sure.
it soon
I will
on
post it
my
soon on my
Facebook and
Facebook and
and thank you
Insta.
so much,
And
Pallavi.
thank you so
That
much,
was
Pallavi. That was
really, really
really
nice to talk to you.
nice to talk to you.
Thank you, Alpa. Thank you so much. And I would like to say it's a fantastic way you are spreading health and wellness message across the board, and you're doing a fantastic job by making this flu awareness camp right now.
Thank you so much.
Thank you.
Thank
Thanks
you.
a lot.
Thank you, everyone.
It was my pleasure.
Thank you, everyone, for watching.
Thank you. Thank you,
Stay
everyone.
tuned for our next
Thank you everyone for watching.
topic.
Stay tuned for our next
Thank you.
topic.
Bye, everyone.
Thanks.
Thank you.
Bye.
Bye, everyone.